this station is discussing what we call risk-reducing surgery. And when we are speaking about the risk-reducing surgery, we can face one of two stations. So the first one is this one. I will discuss both stations in the same recording so that you can know the difference. So the first station you may face in terms of risk-reducing surgery is just a patient who doesn't have any risk factors, and she has like experienced loss of one of her best friends or one of her relatives closely uh, due to breast cancer or ovarian cancer, whatever, and she just know that if she removed her ovaries, she will be protected from that kind of cancer. So she is coming to request and insist on her request to remove both ovaries to be free of cancer. So this is one of the stations. I will show you the other type of the stations that it may come. So this is the other type of the station when there is a patient who is referred to you because she has increased the risk of the lifetime risk of ovarian cancer, and she should be seen by the genetic department before you. So she may be screened for any other reason, and then they found that she has the gene mutation, and then she will be referred to you to talk further about the surgery. Okay, so it's totally different. Here the patient will refuse to remove the ovaries and the breast, and you try to convince her. The other patient is requesting unnecessarily to remove her ovaries or even her breast, and you try to convince her not to do that. Okay, you get the idea. So let's have a look on the first station. So this is a simulated patient task. You are about to see Mac Stephen, a 28-year-old who recently lost her best friend due to breast cancer. She heard about the risk-reducing surgery and she came to request. Okay, so you can imagine one patient who lost her best friend, how states she will be in. So don't say nice to meet you, don't say anything that show happiness on your talking, and try to express your condolences to her and apologize for what happened, and ask her how she is coping, and you understand that she's in severe distress at the moment. So like that. So you have to express your empathy and sympathy with the patient. Okay. Then you ask her about what happened or what came to her mind and why she decided to do that. Okay. And before going through the counseling, we need to ask about her friend. Can you tell me more? I know I'm really sorry to bring these memories back, but do you know at what age was your friend found to have a cancer? And whether your friend has any other family members with the same problem? Have she was screened for gene mutation or any familial cancer syndrome? Okay, so we need to know about her friend's condition because this will support our counseling. If her friend was high risk from the start and then she developed the cancer, that can be used to convince her that you are low risk. You don't need to be to have a risk reducing surgery. Okay. So first, ask about the condition of her friend, disease, and at what age she was diagnosed, and if she has any family member, and that's it. Okay, and then start to take the history as any patient, and stress on the risk factors of ovarian cancer. As I told you before, that you can ask about the risk factors and also the protectors. So BMI more than 30, if she's nullipara or she's having low parity, if she has any family history of ovarian cancer, breast cancer, colorectal cancer, if she was using any fertility treatment, if she have had before any kind of breast lump or breast cancers, if she is smoking. So these are the risk factors. The protectors, on the other hand, the pregnancy, breastfeeding, and oral contraceptive pills. So you ask her about all of these issues during your taking history, and ask her if she's attending any regular screening for breast cancer, or she has any counseling about it. She doesn't, if she knows how to do breast self-examination, whether she has she's up to date with her smears. Actually, she's 28 years, she should have one or two smears at least. Okay, so that's it. So after taking the history, you will find she's totally away from the risk factors of ovarian cancer, and she will be in a status that she insists even if she's not at risk. So what we need to do, we will tell her, yes, Mac, we will respect your wish, whatever you want, we will do, but we need to explain to you all the risks and the benefits. And if everything is clear, then you decide. So what we need to tell her that she's still young, she is 28 years. She will come and remove her ovaries. What is the result of that? The result that she will not be able to become pregnant anymore. The risk if she will have a sudden onset of menopause with all menopausal symptoms like hot flushes, night sweats, mood swings, vaginal dryness, and on the long term run she may develop some heart problems, some bone density problems. Okay, and here if she removes her ovaries for possibility of developing breast cancer or ovarian cancer, how I will give her HRT. Any hormonal treatments like HRT can't be given if you are afraid of breast cancer, right? You removed your ovaries. We can't give you any more hormones because of your breast. It's still there, unless you go and remove also your breast. And you still 28 years and there is no indication for that. Okay, so you may develop osteoporosis, heart disease, as a result of removing your ovaries. And also there are many risks of the surgery itself. The surgery will be done by a keyhole surgery. Okay, this keyhole surgery has its own risk. You will be exposed to anesthesia. You may be at risk for injury to bowel, injury to bladder, any excessive bleeding from injury to blood vessel. If you have any scar tissue inside your tummy, we may convert it to open. Okay, so it carries many risks. So we are not doing or removing a healthy organ for no reason or like no risk. And you know, it's called risk reducing surgery. It is not risk eliminating surgery. So even if we removed your ovary and even if you removed your breast, you still have a minimal chance of developing ovarian cancer or breast cancer. So it's only reducing the ovarian cancer by 95%. And there is still 5% that you may have developing ovarian cancer from the peritoneum or from the omentum. And it's reducing the breast cancer by 50% if you did it before 45 years. Okay? And if you remove your breast as well, you still reduce your risk only up to 95%. This is the maximum thing, okay, we can reduce, but we can't have a risk eliminating surgery. We don't have a guarantee 100% if you removed your ovaries and the breast that you will not get a cancer. Okay, so she will still insist to do the surgery. I'm happy, I don't want any more children, I'm okay, I want my ovaries to be removed. I understand everything, I'm agreeing for everything. So in this situation, you refer her to the genetic counselor to assess her risk and then to come back in another time to make her final decision. The genetic counselor will run some investigations, will check if she has actually any gene mutation or anything that may be needed to be done in this case, or if she doesn't have any risk and she will know now that she is not having any risk and these are the risks of the surgery and she agree in this situation. If she is still insisting, we will do it for her. Okay? But you don't need to do the surgery until she go to the genetic counselor, confirm her genetic status and assess her lifetime risk of ovarian cancer. Okay? Yeah. So it's like a difficult patient and you try to convince her not to do these things. Okay. So the other station in the same issue, 1 minute. Yeah. So this is a simulated patient task assessing patient safety, information gathering, communication with patient, with colleague, and applied clinical knowledge. You are the registrar in the Rapid Access Clinic today. You are about to see Lucy Brown, 36-year-old, who was referred by the genetic department for risk-reducing surgery. She was found to have BRCA2 gene mutation, which put her at increased lifetime risk for ovarian and breast cancer. Please explain to her the benefits and the risk of the surgery and address her concern. In this situation, you will find the patient who is crying. She came because she will know that she will be removing her ovaries. She's at risk of cancer. She may remove her breasts as well. She doesn't want it to be done, but it's for her best interest. So once she presented to you, you introduce yourself by name and role and understand the situation. You tell her, I'm really sorry for what found. I know that you have been screened by the genetic doctor and they found that you are at higher risk than others of developing some kinds of ovarian or breast cancer. And you are keen or you are here to know more about the risk reducing surgery, and if you are happy, we can proceed. Okay, so the risk reducing surgery is recommended when the lifetime risk of ovarian cancer is more than 20%. Okay, and she has to complete her family first. Okay, so she's 36-year-old, and so usually we do it like 40, 45 years. Or if she came at this stage and she told you, I'm okay, we can proceed, I have completed my family, then we can proceed and we will have a better success and better reduction of the rate of the cancer. So what is included in the risk reducing surgery? We will remove both ovaries and both fallopian tubes. Okay? And it's mostly done with a keyhole surgery unless there is contraindication. So the history, you can take the history the same as the previous case because it's the same. But here you may found some risk factors. You may found her sister was diagnosed by breast cancer or her mom. That's why they screened her and she was found to have that. So most probably you'll find here family history of breast cancer or ovarian. So yeah, you need to tell her what is this surgery includes. So as I told you, we'll remove the ovaries, we'll remove both fallopian tubes, and if there is no contraindication, we'll do it through a keyhole surgery. And the aim is to decrease the risk of developing ovarian cancer. Okay, mainly we remove the ovary to reduce the risk of developing ovarian cancer. We remove the breast to reduce the risk of developing breast cancer. So we will not speak about removing the breast here. This is not our specialty. So the patient will be referred to a general surgeon to speak about that. But she is here to speak about our specialty operation, which is removal of ovaries and fallopian tubes. So she came, the aim of the surgery is to reduce the risk of ovarian cancer, but you found that even if you removed the ovaries and fallopian tubes, this also will decrease the risk of having breast cancer, even if you didn't remove your breast, but it will be reduced only by 50%. So if you removed your ovaries and fallopian tube, you will reduce the risk of having ovarian cancer by 95%, and at the same time will reduce your risk to develop breast cancer by 50%. Okay? And it's important to realize that the risk reducing surgery is not risk eliminating surgery. This sentence should be mentioned in here and there. Because also some patients will think that if they remove the ovaries, then they will never have an ovarian cancer. No, it's risk reducing, not risk eliminating. So there are still small chances that you could develop ovarian and peritoneal cancer. And why? Because sometimes very small or very minimal microscopic cancer cells are invisible to the naked eye may have started to grow already in your abdomen or even the pelvis. You can imagine that in the high-risk people, when we remove their ovaries and the tube, it is found that 1 to 3% the histology came back with tubal or ovarian cancer, which is started very early before the surgery. So you have to know that there is a risk of 1 to 3% that we may found a hidden, very early developing cancer cells in your ovaries or fallopian tube. And in this situation, if it is happened, you will need to undergo a further surgery in the next few weeks. Most probably, we will need to remove your womb and send it for histology. We may need to do other peritoneal wash and mental biopsy as well. Okay, so you need also to explain to her the risks of the surgery, the benefits of the surgery. The risks again is she will not be able to become pregnant. She will have a sudden onset of menopause with all menopausal symptoms like hot flushes, night sweats, and mood swings, vaginal dryness, and HRT. She's a very high risk to develop breast cancer. So HRT will be very tricky here, but we can't tell her we can't offer you HRT, like absolutely. We need to do a DEXA scan to assess her bone density. So if the bone density is fine, there is no need for the HRT. But if she has very light bone density, we may consider that very minimal dose of HRT after confirmation from the MDT team, and she may need to repeat the DEXA scan frequently instead if she has a normal bone density until like she reach 50. Okay, so if the patient is below 50, she will need repeated DEXA scan to be sure that she will not need an HRT. But if she needs, then we will weigh the risks and benefits. She may have a very minimal dose of the HRT or alternative drugs to protect her bone, but this is if needed only. Don't forget to explain the risks of the surgery itself. Because it's laparoscopy, so laparoscopy risks injury to bowel, injury to bladder, bleeding from injury to large blood vessel, conversion to laparotomy. Okay, and what are the benefits of risk reducing surgery is to reduce the ovarian cancer by 95%, to reduce the breast cancer by 50%. Okay, and she has to know that she will be followed up with the genetic doctor regularly. She will need a regular DEXA scan to assess her bone density and confirm that she will need still to come for the cervical smears. Some patients, if they remove the ovaries, they will think that everything has been done, no need for any further screening. No, she has to continue her cervical screening as well. Some patients will be okay with that. They will be happy and they will tell you, yeah, we can proceed for the surgery. But some of them will be still reluctant to do the surgery. They will ask for alternatives. So if she tells you, is there any alternative for this surgery? I don't like my ovaries to be removed. I'm planning for babies like that. So if you're still planning for babies, yeah, try to hurry up, bring your babies out, and then we will do it. But if you don't want to remove your ovaries for some other reason, the alternatives are not like better than the surgery. The surgery is the best. But what are the alternatives? We can either measure your CA1 to 5 regularly, while it is not always detecting a cancer. We may offer you to use COC, which is combined oral contraceptive. Okay, it will reduce your ovarian cancer risk by 30 to 60%, but at the same time, it will increase your breast cancer risk. And also, it is not recommended after 35 years. You are now 36. Okay, so these are the alternatives. We can't rely on them. Okay, so she will know that she is at high risk. The best interest for her is to remove the ovaries. If she still insists not to remove them, then we can't do something that she don't like or she don't want to be done. Okay. So that's it. She is already referred to the genetic doctor and she came from there. The other patient, she came by her own, so you need to refer her to the genetic doctor. So these two stations can come on either ways. Okay? Yeah, thank you.